Welcome to The Innovators. Each week, we're serving up real talk with badass women who are just dishing out the truth. No fluff and no BS. Just raw, honest stories and lessons to inspire and empower the next generation. We're here to keep it real and pay it forward. I'm your humble host, Cynthia Nelson, three-time entrepreneur, investor, and advisor. It's a real pleasure today to have Dr. Helena Arteaga, who is the CEO, president, Chief Heffa of New York Health and Hospitals in Elmhurst. Welcome to the show.
No, thank you so much for having me. I love the Chief Heffa. I'm gonna
Hey,
put that like on a
I think you
t-shirt or
need
an
like a big
ID.
t-shirt. You definitely need
Yeah.
a t-shirt with like La Jefa on it.
Yes, I love
Um,
it.
how did you get here? What's your background?
So very interesting. I'm a community activist. My dad was a community activist without really knowing what that is. And of course, I did not want to be anything like my dad. I wanted to be a scientist, be in a lab somewhere. I'm an epidemiologist by trades.
Ah,
But my dad just, instilled something in me that I couldn't like wash away no matter how many books I had or how many labs I was in. Unfortunately, my dad passed away. He didn't have access to healthcare. Interesting enough, when he got sick, we came to Elmhurst Hospital because we're first generation Ecuadorians. So
hmm.
in Ecuador, we have universal healthcare.
Right,
You're like assigned to like a sector, right?
right,
So when we came to the US, there was no Google that said, hey,
right. Here's where
get
you go.
insurance, you're poor. We actually didn't think we were poor because we made it to the US.
Yeah, yeah,
We were what we call the working poor. We didn't know that because we made it to the US. We loved that community. But unfortunately, my dad got really sick and we came to Elmhurst Hospital and we just saw everything that could go wrong went wrong with my dad. We didn't have language interpreters. We didn't have a social worker. No
yeah,
one could explain what was going on with my dad. And to
right.
top it off, we didn't have insurance.
Yeah.
So unfortunately, my dad got diagnosed in November with leukemia stage 4, and then
Mm.
he died that February.
Ugh,
My dad died with ever never getting his Medicaid. And I saw the injustice of not having access to healthcare.
right.
I saw how doctors said, if you don't have the $125, we can't see you. And my dad died in pain. And my dad
Oh,
died in Elmhurst.
yeah.
So I went from being a scientist and the search for knowledge and trying to find the cure for HIV and AIDS, which now we call PrEP,
Yep.
to becoming this activist, to finding like I don't want this to happen to anyone in my community. I still remember it's like sealed in my heart, when the doctor said, "Hey, you need to tell your mom that your father has cancer, has leukemia, and there's not much we can do. He's gonna die." And I remember I barely knew English myself.
Right.
I was only like 17, 18, and I had to tell my mom that the love of her life was dying.
Yeah.
And there was no
Yeah.
support for me either. I was like a
Right.
young kid.
Yeah.
I look at my son who's going to be 18 in October, and I was like, I was his age when my world turned upside down.
Yeah.
And so I vowed never for that to happen to anyone in my community. At that time, Corona had the worst health indicators on the planet, basically. We
Hmm.
had the highest TB rates, and I remember searching this up in the library in the big books
Yeah.
that said Corona was a red zone for TB. We had the highest rate for HIV and AIDS because, of
Yeah.
course, our community didn't understand
Didn't
that.
understand,
We
didn't
had the
know.
highest rate of maternal deaths and infant deaths, and we had the highest rate of teen pregnancy. It was like the South Bronx and us.
Yeah.
And I said, no, I was like, something needs to change.
Yeah.
And I remember talking to my dad's best friend was a priest, and he was like not just a priest, he was like the godfather of the neighborhood.
Right.
And he was like, Helen, you could do something. And I remember, like, what can I
What can
really
I do?
do? I'm an
Right.
immigrant girl who barely understands English. And he's like, what would you do? And I was like, I would build a clinic where everyone could be seen in their own language. And poof, Plaza del Sol Family Health Center was born. It took me 11 years to fundraise and build and, get the right support to build it, get the right board, meet the right people. I had so many
Yeah.
people saying no to me at the beginning because I was this young girl who they were like, there's no way this chick can do this.
Yeah.
But I'm happy to report in 2009, with the support of another crazy woman leader, Paloma Hernandez, who was willing enough and crazy enough to give me $4 million to build Plaza de Sol Family Health Center. And we opened in 2009 in June with 38 patients. And right before I left for the pandemic to come run Elmhurst, we had over 39,000 families that we took care of. We delivered over 1,000 healthy babies. We delivered, not only healthy babies, but we kept babies healthy to the
Yeah.
age of 5. And we really transformed the health indicators. And Plaza Sol got many awards, and it stood on its own on what it did to the zip code of 11368.
That's
And,
amazing.
and then bam, hits the pandemic. I'm all
Pandemic.
happy in my
Yeah.
happy land.
Yeah.
And I get really sick because, of course, I'm helping my community activism,
Yeah. You're
doing the
in the
whole
middle of
nine.
it. Yeah.
Wear masks, don't wear masks, this whole
Yeah.
thing. And of
Yeah.
course, I get severely sick and I end up at Elmhurst Hospital
Uh,
in the emergency room.
uh,
The last thoughts in my mind were
oh my
like, oh
God.
my God.
I can't die. I can't be here. Oh my God.
I was like, I cannot die in the same place my father died. Like it's
Yeah.
the
Right.
same emergency room.
Yeah.
And I was like, all right, God, if you help me out on this one, I promise to be nice to Elmers.
Yeah. I will do my best.
I do my best. And little did I know, the current CEO of that time was asked to help the next epicenter of the pandemic, which was Chicago. And he went to Chicago, and Elmers, the CEO position of Elmers was open. And believe it or not, while I was healing and getting better because I had long COVID, it was
Yeah.
really, really bad. And I was like, oh no, I'm not healthy enough to run this. People kept saying my name that I should apply. And I was like, nah, 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 nah. I was like, I belong in a lab, taking care of my children. I was like, I'm gonna do this, because this time, I was working on my dissertation. I was like, I
Right.
belong in a lab somewhere, quiet
Yeah.
life, reading a book, teaching. And my sons were at dinner, were like, Mom, what's wrong with you? And I was like, what do you mean, what's wrong with me? And my son, sometimes you always have that voice that reminds you of who you are to the core.
Yeah.
It's like, the mom we know would
Oh,
never say no to this opportunity,
back down from a challenge. Uh-huh.
back down from a challenge. And I was like, and you just like, no, no, I'm still strong. And they were like, the mom we know would apply for that job.
Huh.
And just that reminder of the essence of who I am and who my
Right.
father was, of really defending our community, really being an advocate for the core of who I am is always a community person. And during the pandemic, that's what we needed in our neighborhoods. So that night, I was like, all right. And I'm like, what's the worst thing that can happen? They hire me?
Yeah.
Because by this point, I'm a very strong advocate. People really know me. I speak my
Right.
mind. I
Right.
defend my community. And so I apply. And when I apply here in Health and Hospital, a little number pops out. That's the number of applicants you are, the number
Right.
you are. And it
Right.
came out to 311.
And you're like, okay, it's never
I
gonna
was like,
happen.
this is such a long shot. But I was like, I'm showing my boys I'm not not a loser. I'm still a fighter. And little did I know, 21 interviews later,
Oh,
I became the first woman and the first Latina CEO of Elmhurst Hospital in its 190-year history.
well, they at least, I mean, yeah, you're the first woman of color and the first Latina.
Yeah.
You know, obviously, your background in not only the health and health services side, but the story that you just told and your community activism contributes directly to the patients that you serve. I mean, you've won, you know, best hospital, best regional hospital, highest performing in like let's like heart failure, heart attack, stroke, hip fracture, kidney failure, orthopedics, pneumonia, and CPOD. I mean, best regional in all those areas. Obviously, you've done something right. What do you think has made the hospital, really become one of the best in the country?
I think because I'm an advocate first, I'm a
Mm-hmm.
patient first.
Mm-hmm.
And I think
Mm-hmm.
having that mindset is really different how I lead, right? When I make decisions, I'm not making the decision on a business plan. I'm not making decision on like getting that award. I'm really
Right.
thinking of the decision of like working on, heart disease. is that going to help my community? If the answer is yes, I'm like, okay, let's go all in. What do we need our community? Let's figure out where our community members are coming from. And because I have that scientist mindset,
Mhm.
it's not a doctor mindset, which is, it's great.
Different.
It's a different mindset. So I'm
Right.
always thinking of that patient zero, or I'm thinking where the weak link is, or
Right.
like where is that point that it breaks so I can try to figure out how to heal it, right?
Hmm.
Because we can have all the services here at the hospital, but if the patients don't come, it's not going to
Right.
change anything.
Right.
And
Nothing.
if
There's
they come and I don't change their behaviors, it's
right.
not going to change anything either.
Right.
I think I
Definitely.
bring that different piece to it.
I think that whole patient first mentality is so critical, right? Because I mean, I think we've all had experiences with doctors where you're like, yeah, they don't care. Yeah, they don't really care, even with insurance.
Yeah.
Even with the ability and insurance, you're like, yeah, that wasn't an exam. That wasn't a, there's no, it's just, I'm just a number on a sheet of somebody that they're servicing, period, and they're meeting their quota, whatever
Yeah.
it happens to be. The patient first mentality obviously has driven the hospital becoming, like I said, one of the best regional hospitals in the country. And I'm sure your community must be so proud.
Oh, there, and one of the things that I'm very proud in, even now when in our political climate that we're
Yeah,
living in,
yeah,
there's a lot of clinical areas
yeah,
that have seen a low number of patients coming in. They've seen their volumes decrease.
yeah,
And here at Elmhurst,
yeah.
people trust us.
They
People
try,
know that they are going to come in here and we're going
they're
to
safe.
protect them and guide them in their health journey.
Yeah.
We're about getting them healthy because at the end of the day, if you're not healthy,
Yeah.
you don't have the encouragement to go to school, study more, do a podcast, take that
Go to
run.
work, take care of your
Yes.
family, contribute, all of those things. Especially, I know with maternal health care in Latinas, it's always been such a big issue. Not
Hmm.
going to the hospital, not going to the doctor for the right checkups, and ending up in the ER with preeclampsia and dying sometimes, right? Or the
Yeah.
baby died. Horrible things that absolutely shouldn't be happening in this day and age, but that trust, again, patient first equals trust. Um, Now last year in March of 2024, you're recognized by our governor, Kathy Hochul, for your work with the state's Latina Mentoring Initiative and for
Yeah.
your accomplishments promoting health equality. How does mentoring play in your daily life and your life at the hospital all around?
I think when I was growing up, I didn't see that many women CEOs or women. Even now, when I was applying, sadly, there are not that many women CEOs to begin with.
Yeah,
And I think seeing someone like me in gives not that everybody needs to become a CEO, but I think understanding someone like me getting to where her dreams came to be, if
right.
I can help the younger generation see that,
Hmm.
especially in communities of color where
Hmm.
they don't get to see a lot of role models, they only get to see the negative things in our community.
Yeah,
And especially again, this current climate
yeah.
where people are told, that most immigrant communities are bad people
Ugh, which is
or
so stupid.
criminals or like sex workers or not right
Yeah,
for America. I think it's important for me to show them like, look, I went through your own path as well, and
right.
I am perfect. I'm a good American. I'm making my American dreams come true, and then I'm coming back and giving back.
Yeah,
I think it's important for them to see the light at the end of the tunnel. Not that I'm
yeah,
everybody's light, but
right.
I think I have enough light to remind them that there is a light.
Yeah. If you
Because
can
right
see
now,
it, you
when the
can be
whole
it,
world,
right?
yeah, when the
Yeah,
whole world is telling you you suck,
yeah,
I want
yeah.
to be the reminder that you don't suck.
You don't suck. Yeah, I love that. You don't. That's another one. Lahefa, hashtag you don't suck.
Yeah. Yes,
This
I
is the
love
new
it.
t-shirt. We're passing this t-shirt around. Um, Over the course of time, like what's the most kind of invaluable piece of advice that you've received?
That dreams don't expire.
Ah,
I think it's so important for us. We get on this like timeline, and especially now when you see everything on TikTok and
yeah,
you think
yeah,
everything happens tomorrow. I think understanding that, your dreams don't expire. It might not take, like if I have the goal of like, of getting the hospital to a certain level in 5 years. Okay, if I don't do it in five, but I do it in seven.
Yeah.
The important thing is that I get there.
Yeah.
And when I get that frustrated, I always tell myself, well, my dreams don't have an expiration date. So
That's a
that's
great piece
very
of advice.
reassuring to myself.
What would be a piece of advice you would give your 25-year-old self?
Oh my God. First, don't date that guy.
Okay, that's the first one I've heard. That's awesome though, but
Like, don't
I hear
date
you.
him.
I hear you. I
Not
hear
good
you.
juju BBs for you. No.
Yeah,
Run
I
away.
totally,
Go away. But the second thing I would tell my 25-year-old, you know, it will get easier. Trust in yourself. It will get easier. And you know what? At 25, what you're doing, it's okay.
yeah,
It's what you got.
yeah,
Because at 25 years old, I felt very closed to the world. I felt very alone. It was a dark moment in my because
yeah,
so many doors were closing for Plaza del Sol.
yeah.
I was about to give up in opening the health center. I tried to fundraise so much, because it costs a lot of money to open a health center.
Sure, sure.
And, I was about to give up at 25, and I'm glad I didn't,
That's
you know.
awesome. Helen, thank you so much for
Oh,
your
thank you.
time. I so appreciate it. And Elmhurst all the way.
Yes, all the way. And we're strong. Have a
Yeah,
great day.
Elmhurst song. You too. Thank you.
Bye.